Imbalance in T helper 17 cells and targeted therapy in an infant with SAM.like syndrome. Definition: SAM syndrome, which is characterized by xerodermatitis, multiple allergies, and metabolic wasting in congenital skin disease, caused by mutations in the genes encoding in desmoglein or demopleagin. This mutation results in reduced epidermal integrity, which may be lethal in children because of recurrent sepsis and extreme undernourishment. The immunopathogenic mechanism remains uncertain until treatments have been available. Morir esta computadora. Applications in medicine. Available treatments targeting T17 cells include biologic drugs that are currently licensed for psoriasis therapy, such as ustekinumab and secukinumab. Ustekinumab was recently evaluated with encouraging results in 2 patients with DSP mutation but obtained little cutaneous improvement, and another patient with SAM syndrome who had DSG1 mutations.
Your study today of secukinumab, you showed that this is effective, the first drug shown to be effective in ankylosing spondylitis. Talk a bit about the pathway and how this drug works.
It's the first non-anti-TNF biological to be effective. Of course, TNF blockers are effective, but it's the first non-anti-TNF blocker that is effective. The pathway is well studied in experimental models. We know that IL-23 is the upstream cytokine driving cells to produce IL-17A, and IL-17A is a very potent pro-inflammatory.
Results shown are photographs of an infant girl with SAM-like syndrome obtained 16 weeks before and 35 weeks after the initiation of therapy with secukinumab. Graphs represent the mean count of T17 cells per cubic millimeter and the mean frequency of the interleukin 17 producing cells engaged T cells in infant over time and is compared with growth curves of the World Health Organization W curves increase in infant growth after initiation.
Geckerman therapy, which was sort of invented back in 1920, was a combination of tar, which was noted to have good skin effects for skin diseases, particularly psoriasis, and ultraviolet light.
The big advantages to Geckerman treatment are that relief can be derived very quickly. Patients feel better in a short period of time, often within days to a few weeks.
Obviously, Geckerman therapy has been around a long time. We have a lot of experience with it. It's very safe.
So the advantages of topical treatments for psoriasis are that
Conclusions. The major effect of secukinumab, our patient's quality of life suffers interleukin 17A as new target to treat patients with seriously of disorders such as SAM syndrome primarily.